In health news, new studies out show that obese men may be at greater risk for infertility than men of normal weight. Dr. Parviz Kavoussi is a reproductive urologist at St. David's South Austin Medical Center. He joins us now to talk about this. Dr. Kavoussi, good to see you. Thank you for the visit.
Good morning. Thank you for having me.
How big a problem is this? Let's start with that.
Well, seems like it's going to be a very big problem for us, and it's getting worse. We know that there's certainly an epidemic of obesity that's a global problem, and about a third of adults now are considered obese. Parallel to that, there's been an increase in male infertility, and the rate of male infertility seems to be going up and up along with the increase in obesity.
Well, how far back did the red flag go up when you could link obesity with infertility?
It's gone back quite a ways. We certainly clinically see more men that are overweight that do have more difficulty achieving a pregnancy. We have known scientifically why some of those reasons are for some time, but we're learning more and more about it now. The most recent study that's come out is a meta-analysis that actually looks at data from 14 different studies that covers almost 10,000 men. And we see that men that are of normal weight have more normal semen parameters and more normal sperm counts compared to the ones that are overweight. In fact, the ones that are overweight, the percentage of men that have normal semen parameters really goes down quite a bit. It goes from about a quarter of men that have low sperm counts in the normal weighted men up to about a third of the men when they're considered obese. The number of men that have no sperm in their semen whatsoever, the percentage of men goes up from about 2.6% to almost 7%. So that's a massive increase that seems to be strongly associated with their weight.
Well, true enough. Those are amazing numbers when you talk about the ratios there. So let me ask you this. Is it merely a question of these men getting their weight back to normal, or is there some kind of residual effect even if they do that?
That's a great question that unfortunately we don't have the perfect answer to yet. Our science hasn't quite caught up to us from that standpoint yet. We certainly do encourage the men to try to get more fit and to burn their body mass. We know that we believe there's a few different mechanisms that's affecting their fertility when they're obese. We know that there's a protein in fat cells that turns a man's testosterone into estrogen, and it's normal for men to have a certain level of estrogen, but as you put on more fat cells, you produce more estrogen, and that testosterone to estrogen ratio decreases, and we know that's bad for fertility. Also, when you put on more fat cells, there's more fat cells in the lower pelvis, in the scrotal area. That may increase temperatures around the testicles, and that's also bad for sperm production. If you look at how men are built, the testicles are basically outside of the body because sperm are produced best at about a 2 to 4 degree cooler temperature than the core body temperature. So that temperature change can affect the sperm production as well.
Well, a quick question, I'll let you go too then. The patients you see, are they generally proactive in their treatments?
Fertility is a very big motivator. Couples that want to build their family are very motivated to do what it takes, and they certainly are proactive in getting a healthier diet, low-fat, low-cholesterol diet, and their cardiovascular exercise in, and that's a great first step.
Gotcha. Dr. Parviz Kavoussi is a reproductive urologist at St. David's South Austin Medical Center. Doctor, thank you. We appreciate it.
Thank you.
You bet.